After President Trump's vows to dismantle the U.S. Department of Education, the agency is now bracing for the impact of this current government shutdown. A small fraction of its employees are being required to continue working, with nearly 90% being furloughed. I want to discuss that and more with the former Education Secretary under President Obama, Arne Duncan. Secretary Duncan, thanks so much for joining us. The president, as you know, is threatening to use this current shutdown as an opportunity to fire even more federal workers, including over the Department of Education. What impact is this likely to have on the Education Department and the impact on kids out there who need to have a good education?
Well, Trump has done everything he can to attack education, dismantle education, attack higher education. So this is just another excuse to do that. And unfortunately, the dismantling of education actually started when he selected Linda McMahon to be his education secretary. She went to an education technology conference and started talking about A1. No one knew what she was talking about. She meant AI. She's that incredibly ignorant of the most massive change that's ever happened. And what's so sad to me, Wolf, is education should be the ultimate bipartisan or nonpartisan issue. There's nothing left or right or Republican and Democrat about more babies getting off to a good start in pre-K, raising reading scores, which is horrific, increasing high school graduation rates, more young people going on to college. Those are nation-building goals. But in this administration, there are no education goals. There are no strategies to achieve them. There are no metrics to measure them. And there's no accountability. There's no public transparency. So it's just an incredibly disheartening time for our country and for our nation's children.
So what are your biggest concerns, Secretary Duncan, right now as this shutdown potentially drags on?
Well, obviously, it impacts, people across the country, left, right, red states, blue states, it doesn't matter. Having that workforce disappear, having folks, who have been living check to check no longer receive those checks. That stress on American families, that stress on children is extraordinary. And so there's no upside for America in this. And the fact that we're fighting to keep health care, it's just mind-boggling to me. As you well know, everyone fighting to strip Americans of health care, every single one in Congress who is fighting for that, they and their families and everyone they love have access to health care. There is no one who does not have health care who's fighting to take it away. And so the lack of honesty, the disingenuousness of this is just staggering. And to be clear, obviously, Democrats are fighting for the health care of everybody. It doesn't matter who they are, who they vote for, where they live. That's what's at stake here.
And as you know, right now, thousands and thousands of young people here in the United States are preparing to apply for financial aid to go to college. There are also millions who are making student loan payments. How will they all be impacted by this government shutdown?
Well, we will see, but Trump and his administration have been very clear. They want to see fewer people have access to higher education. They are actively attacking the institution of higher education, just as they're attacking the free press. Just as they're attacking the media, just as they're attacking judges. And it's all part of an authoritarian leader's playbook. When people can think independently, when people can think critically, when they go to college, when they have those skills, they're not going to listen to one source of truth. And so this is just another excuse, another opportunity for Trump and his team to make it much harder for folks to go to college. And again, does a tremendous, tremendous disservice to our country. Higher education has been the goose that has laid the golden egg for decades here in America. And all the jobs, all the innovation, all the creativity coming out of higher education, they are taking that on in a full frontal assault.
Secretary Duncan, thanks so much for joining us.
Thanks so much for having me.
Pamela.
All right, just ahead, we're going to take you live to Memphis. Hundreds of federal law enforcement officers are there setting up shop as part of President Trump's crime crackdown.
Ever worry that you're drinking too much? Take back control with Or Health. Or Health provides access to medication proven to help. A daily pill to drink less, or to quit drinking altogether. Text TV1 to 710-710 to learn more.
At Humana, we believe your health care should evolve with you. And part of that evolution means choosing the right Medicare plan for you. Humana can help. Hi, my name is Sam Davis, and I'm going to tell you about Medicare Advantage prescription drug plans that can provide more coverage than original Medicare, including prescription drug coverage, all wrapped up into one convenient plan. With Original Medicare, you're covered for hospital stays and doctor office visits, but you have to meet a deductible for each, and then you're still responsible for 20% of the cost. Next, let's look at Medicare supplement plans. If a service is covered under Original Medicare, then a Medicare supplement plan pays for some or all of your Medicare deductibles and the 20% co-insurance. But they may have higher monthly premiums and no prescription drug coverage. Humana Medicare Advantage prescription drug plans include medical coverage, plus prescription drug coverage, with $0 copays on hundreds of prescriptions. All plans include $0 copays for covered preventive dental services, vision coverage that includes vision exams and a yearly allowance toward eyewear,